Hi, everybody. My name is Dr. Reza Alkef. I'm a aesthetic physician practicing in Canada. I'm trying to make some series of videos, and my goal by making this video is to give my clients some kind of basic information about the beauty, about the skin regimen, skin treatments, and some of the common procedures that we are doing in our clinic. Because in all the years that I'm practicing, I understood that if my clients have some of this type of basic information, it's going to be much easier for them at the time of consultation to understand what are their realistic goals are. And when we are talking about the treatment plan, they have a better understanding the treatment plan and again the expectation that is going to come after that. In this video, I would like to talk about one of the very important topics, which is the action of the hyaluronic acid and skin beauty. And the reason I chose this topic is that we know that in these days, we heard all the time about the hyaluronic acid, and many people asking me this question: what is a hyaluronic acid and how it's going to affect our beauty and how it can reverse our aging? So before I go through this topic, I would like to quickly review what are the characteristics of a healthy and beautiful and youthful skin. So first of all, this is me. I'm going to take myself from here. Yeah, this is me. Again, my name is Dr. Reza Akif. I'm an aesthetic physician. I have more than 10 years experience in this field. I have treated many patients with the different ethnics, and majority of my patients are Asian clients. I'm the chairman of the Canadian Board of Aesthetic Medicine, so I have a lot of experience in teaching as well. So I have taught many healthcare professionals in the field of aesthetic medicine, and I'm also an international speaker in the different congresses and conferences. So characteristic of a healthy and young skin. So we all know that we all want to have a healthy and young skin. And what are the characteristics of that? So definitely a healthy and young skin is always well hydrated. It's good moisture. It means that it's a very good balance between the oil and also the hydration of the skin. It's soft to touch. It's always glowing and bright, and we have a lot of light reflexes, not much shadowing. There's almost no wrinkles or very minimal wrinkle, very minimal pigmentation. So we don't see pigmentation or any type of skin discolorations. It's nice and plump, it's firm, so it's not loose. Definitely on the other side of that, what are the characteristics of the aging of the skin? So definitely an aged skin, as you can see in this nice lady, it's dry, you see a lot of wrinkles, the skin is not plump anymore, it looks like it's very thin, and it's loose, it's not firm. It seems that the patient has lost a lot of fat tissue under the skin, so again, it's not plump. You see pigmentation and some kind of skin discoloration, and it's not so bright. You see shadowing. Instead of the light reflex, you see more shadowing. So definitely, we don't want to get to that extreme of aging, so we try to reverse some of them by different type of treatment or prevention techniques. But hyaluronic acid, what is hyaluronic acid? So hyaluronic acid, it's a natural sugar. So everybody has hyaluronic acid in the body. And where is it the most? It's mostly in the skin, in the cartilages, in your joints, in your bone structure, but a lot of hyaluronic acid in your skin. And the action of the hyaluronic acid in your skin is to keep it well hydrated, because hyaluronic acid can absorb a lot of water. So that skin is going to stay very nice and well hydrated. It's going to stay plump, but unfortunately, by the process of the aging, the amount of the hyaluronic acid is going to go down, as you can see here. So after the age of about 30, so we all started losing some of the hyaluronic acid. It's going to start even from the birth, but after age of 30, the steep of that is going to be very fast. Between the age of 30 to 60, we have a very significant degradation and decreased amount of the hyaluronic acid. And that's usually the time that you gradually start to seeing some of the aging. And this is a very good time to start treatment before we get to the very severe aging process. So do we have different form of hyaluronic acid? Of course we do have it. So we have different type of topical creams. We have different type of the serums that you can apply it as a topical cream. Sometimes we are using a hyaluronic acid as a liquid, and then we are using a machine that we call the microneedling. We try to give back some of the hyaluronic acid that you have lost during the time to skin to again give the skin the chance to get hydrated again and to repair part of the aging sign. But we all know that usually topical creams and topical ways to apply the hyaluronic acid is not as effective as when we are injecting, although this combination helps always the most. So topical plus the injectables. So by injection of the hyaluronic acid, we are trying to again to boost and help your skin to hydrate and again rejuvenate. There are different types of hyaluronic acid injections that we can offer you. So it can be just a very simple hyaluronic acid, just hydrate your skin, or sometimes we have kind of different type of hyaluronic acid that we use it as a giving some of the volume back to your filler, and we call it fillers. So next time you hear filler, most of the filler that we have in the market in these days, the basic structure of the fillers is hyaluronic acid as well. That's our first video. In the next video, we're going to go more details about the topical ways of using hyaluronic acid. Thank you.